metaphysical surgery. That is to say that I assist individuals, I do have a general practice now, in being able to move into their mental and emotional bodies and to eradicate the disharmony which is actually reflected in the physical body as disease. So we actually move beyond the physical body, and I have some very interesting tools that I use. I always state that my scalpel is love, that my suture is compassion, okay? And we actually go into these areas that are very delicate and sacred to individuals to help them see how the physical malady that they have is really originating from mind and spiritual conflict. So we're going to talk about hysterectomy because I've had quite a few women come up to me over the years since I've left my traditional practice in 1981, and they say, "Oh, Dr. Smith," at that time my name was Dr. Smith, "don't you remember me?" And I just smile very pleasantly, and they say, "You did such a wonderful job, and you took my uterus out. I don't have any scars or anything, and at first I used to cringe when I heard that because it's like, oh my gosh, in my ignorance, this is what I had done to somebody. But realizing that everything is perfect, there's no such thing as mistakes, etc. Working with women with uterine fibroids, I realized as it was revealed to me what uterine fibroids represented. And I'll just generally just give you the signature, as we call it, is that uterine fibroids is a reflection of a woman who is misusing her creative energies. And when I began to delve deeply into the research as to how this manifests in a personal way, in a collective way amongst women, reflecting back on the research and realizing that hysterectomies primarily are done, at least in the African American female population, for fibroids, and elucidating what the treatment is, which is what our uterine fibroid program is about, I recognize that these women had not been treated, that their bodies had been disarticulated to remove the physical symptom, but the real seed of the disease had not even been addressed. So it was a real important issue because when we're talking about now and needing to move into the 21st century, that we all have to come of one mind, it is a real challenge for an individual to come of one mind when they consciously don't identify that they have any problem that would want them or motivate them to change. And this is actually what has happened to the woman that has had a hysterectomy. So let's just kind of look at this in detail and you get a clear understanding of what we're talking about. For those of you who are not very aware of your reproductive organs, and this is something that is demanded of all of us if we're going to have a healthy body on the planet, is that we must know thyself. So this is actually the uterus, the tubes, and the ovaries, which are quite obvious. Here's our tubes, our ovaries, the uterus, and this is actually the sheath that it's covered in. It's known as the broad ligament, and there's a couple other ligaments that help keep this suspended in the pelvis. It actually is on a string. Now this V incision here is the vagina that has been cut away. So when a pap smear is done or when a speculum exam is done, all we can see is actually the long tube, which is the vagina, and the cervix. None of this is visible at the time of a pelvic examination. The ovaries cannot be seen, the tubes cannot be seen, nor can the actual womb or uterus be seen. That's why after visualization of the vagina and cervix, because this is the area that is scraped for a pap smear, the physician then gently inserts the hands into the vagina and presses on the lower pelvic area, the lower stomach. And the reason why is because now they're trying to feel the size of the ovaries, feel the size of the womb, and depending, perhaps even the tubes. Normally tubes are very soft, even softer than the earthworm, so you can't feel them in a healthy woman. But when you can feel them, then we know we have problems. This is a sagittal section, that is, it's cut right in half on the side of how this organ looks. Okay, and if you can see that the total thing is completely hollow and that the tubes all connect to the actual inside of the uterus, which is the endometrial cavity. And this is where the food builds up every month, which is actually blood, for an incoming fetus if the ovum, which are the names of the eggs in the ovary, is fertilized by a sperm. have in the corner an example of where this sits, right behind the pubic bone, that little hard bone in front. And then we have an example also at the time of pelvic examination with the speculum, how your cervix looks before, which is nulliparous, and after, which is multiparous, after having children. So here it kind of looks like what we call a donut, and then it becomes more fish mouth after having children. On a side view, this is how it sits in the pelvis. If you just would cut me down the side, this is exactly how the uterus actually looks. Okay. Now, this is very interesting because here we have taken a woman and we've opened her up surgically. We've sawed her in half. This is the pubic bone right here that's been cut in half. And we've actually pulled the uterus out of its normal place. And here's the actual forceps on the uterus. We've cut the rectum because the rectum is right behind the uterus, and right in front of the uterus is the bladder. It sits right here. And normally the uterus lays right on top of the bladder, but in this case we've taken the forceps and pulled it down because they are exhibiting all of the nerves that actually cover the uterus, the tubes, and the ovaries. Now these nerves, plexus of nerves, are very important. And in my medical school days, I spent a lot of time dissecting this whole thing out. And it's very interesting because these are the nerves that are responsible for you being able to have sensation of labor, also to be able to feel when you ovulate, also to be able to enjoy sexual activity and orgasm.